Hello everyone! Welcome again to my YouTube channel. It's me, Alona, your breastfeeding and lactation consultant. So today, I want to talk about breastfeeding. Okay, I'm done with some of my other videos about home and decorating and storing. Now I want to talk about breastfeeding. Okay, so for some moms who are kind of confused about what's the difference between breast engorgement and breast fullness. Okay, so it sounds the same, but it's different. It's the same in the way how sometimes the breast look like, but I'm going to show you or tell you the differences between what is an engorged breast and what is a breast fullness or a full breast. Okay, so I have a model here. So typically, commonly, most Asian have this breast size, smaller size. For Western women, they have a little bit bigger than the Asian sizes of breast, okay? It's just how Asian women's body are built, okay? So this breast model I have is like, there's some Asian women who also have bigger breasts, but I'm going to tell you the difference on what the differences between an engorged breast and a breast fullness or a full breast. Okay, I'm going to start with an engorged breast. So I did a lot of home visits when I was a public health nurse, and I've seen so many moms complained about having engorgement, especially this happens after 3 days, or if you are a second-timer mom or third-timer mom, normally 3 days. For first-time moms, sometimes it takes 3 to 5 days that the milk will come in and then they started to get engorged and very, very full. So for breast engorgement, the number one, oh there I have a tape. The number one symptoms or signs that the mom would complain is the pain. It's just the pain of their breast. And I could always tell every time I do home visits, when the mom is severely engorged, when I can see the skin of the breast is so shiny, and the skin is really, really stretched and so tight. And that's how I know that the mom is really, really experiencing breast engorgement. So we'll just imagine this is a breast, okay? Normally, for very severely engorged breasts, the skin is just shiny, and even when you touch it, you can feel warm, and some moms, every time if I ask permission if I can touch it, about how hard it is, sometimes they even scream for pain when you do that. So it is an engorged breast. However, normal fullness of breast, it should not be painful. Okay, it should not be painful. For first-time moms, sometimes when they get really, really full, they kind of feel very uncomfortable because again, it's the first time that your breast is stretched out from this size, if you're this size, and to this size. Believe me, there's magic in the milk. After I gave birth, from a size B to probably a D size. That's how the breast size increases after you gave birth. So it varies. Some women will have maybe double the size. Some women may have maybe triple the size. And believe me, it happens. So a breast fullness should not be in severe pain. Okay, it's just a full. When you touch it, you can still touch it without so much severe pain. But for engorgement, some women don't even want to touch because it is just so much painful. So what are you going to do when you have this problem? Either you're going to have breast engorgement or you have full breast. I'm going to start with breast engorgement, and I did it in the previous video. If you haven't watched it before, I'm going to do it again about breast engorgement. Now, severe engorgement, meaning there's just too much milk in the breast, okay? Either you're a first-time mom or second-timer mom. Based on research, the more you get pregnant, some women will produce more milk. But that depends if the next pregnancy is healthier or the second pregnancy is healthier. Because there's some women who develop complications during first, second birth or third birth, and sometimes that compromise your milk supply. So it depends. But based on research, the more you get pregnant or multiple pregnancies, you may have double your milk supply. So if you're severely engorged, the best thing to do that is to really remove that milk. Remove that milk. When you are engorged, take note, your milk flow slows down. And some moms do not understand this. They think they're so full, they're engorged, they should have tons of milk flow. Some moms do not, their milk flow will slow down. Why? Because the ducts inside our breast, the ducts inside our breast is swelling. So when that swelling, it constricts the flow of the milk into the nipple area. So you may have tons of milk there, but the flow slows down, and the baby would also struggle to latch because, again, your breast is very, very hard. So what you need to do is make sure that you remove the milk. Either you can do it by pump, if you can handle the pain when you're doing the pump. If the pain is too much to use the pump, use your hand to manually express it. And again, I have manual breast expression video before that you can go through it again. It is important that you need to remove it. Why? Some women with breast engorgement will develop fever, will have headache, they're so much in pain, and also, again, it compromises the flow of the milk. When this engorgement stays longer, maybe another day or 2 days, it slows down the milk production. So we don't want that one to happen, okay? We don't want it to happen. We need the flow to be continuous, and we need the pain to go away. The only way you can relieve that pain is to remove the milk via pumping or milk expression. And then after doing that, either you can put a cold pack to relieve the swelling, and then later on when the pain goes away, you can use a warm pack. And again, you can go back to my YouTube video about breast engorgement so that you can see the whole process of how I massage the breast. Now, with the breast fullness, you need to also ensure that your breast is well maintained, the milk supply is well maintained. Because if your breast continues to get really, really full, it can lead to engorgement, and then it can lead to mastitis. We don't want that. Having breast infection is very painful, okay? I've seen this many times in our breastfeeding clinic that moms were crying because of so much pain because of mastitis, and we don't want that. Breast fullness is a good sign of good milk supply. It is, hallelujah. Not so many women are gifted to have breast fullness of milk supply. But again, with having full breast, you make sure that you maintain frequent feeding. Either you can do it every 2 hours or every 3 hours, depends on the age of the baby. The younger the baby, the more baby eats, okay? Babies probably can eat 8 to 10 times a day, or it depends. It depends on the milk supply. So make sure that you maintain breastfeeding. If you feel like after feeding you're still very full, you're still very hard, and you don't want to get engorgement, so you can relieve some, you can express some by a pump or massage it, store it, put it aside so that during the night your hubby or partner will be able to help you feed the baby while you can rest. But making sure that you maintain your milk supply, but more by monitoring how full is your breast, is it comfortable, is it uncomfortable. Now, there are many ways now on how you can relieve the pain if you have breast engorgement. Some doctors would say you can take ibuprofen. anything Advil or anything ibuprofen, but make sure you ask your doctor for any medication that you're taking. These medications can still have side effect in your breast milk, but it may be only 1%, 2%, but it's very important that you need to discuss with your healthcare provider before you take any medication when you're breastfeeding or when you're, especially when you're pregnant. So this engorgement and fullness, as I mentioned before, it's a little bit confusing for some moms. They cannot tell, are they engorged? Are they just full? So engorgement, again, most women will experience the pain, okay? It's the pain. Sometimes it's uncomfortable. Their skin is stretchy, and sometimes even it's painful to touch. So that's the difference between just a normal fullness of breast. And be thankful if you just have the normal fullness of breast, but again, it's the way in how you manage your milk supply, okay? Breastfeeding frequently, removing the milk as much as you can if you are having problem with engorgement. Now take note, if you have tons and tons of milk too, and you pump all the time because you want to store it or you want to save it, make sure that you're breastfeeding your baby first before you do it, so that you will not sometimes drain all the milk, and then the baby gonna be frustrated when you're latching when there's not enough anymore, okay? Some moms with tons of milk supply would express milk first for 5 minutes maybe and breastfeed the baby, because that's where the fat, most fat of the milk is left, and take out the last fat here, but still nutritious. You don't throw it away, keep it in your fridge. So that's the difference between an engorged breast and a full breast. So make sure you know the differences. If you have any comments, any questions, feel free to message me, comment, and like this video. Please follow me there, because I'll be posting tons and tons of videos again every week, 2 weeks, 2 to 3 days, and other things about baby and pregnancy. So see you again in my next video. Thanks again for watching, and please don't forget to share and subscribe. See you again, and have a really nice day.